Looks like it's about time. All right, we'll get started. Welcome, everybody. Thank you for everybody who was able to join us this evening. Today, I have the pleasure to host with Dr. Tommy Martin. Many of you might know him from his TikTok. He's going to be here with us today and talking about his journey, and he has a very interesting case study prepared for us. And I will let Dr. Martin briefly introduce himself, and then I will go over a couple of things for those people who are new, who are just joining us for the first time. I will go through a couple of minor details that'll make for you to understand, be easy for you to understand the program. Dr. Martin, I'll let you briefly introduce yourself.
Great. Thank you so much. I'm so honored that you guys would want to have me on your YouTube session. So thank you again for having me for this live session. So just a little bit about myself, and I'm going to go into a lot more, so I'll just keep it really short. I'm a third-year MedPeds resident. So that's a combined internal medicine and a pediatric residency. So I do adult medicine and I do kid medicine. I'm married to my beautiful wife, who's a pediatric resident. We're both in our third year, so she's almost done, and I'm got one more year left. And we're working at the University of Arkansas.
Cool. Okay. If Dr. Martin, if you could click on the link under Instagram,
Yeah.
Club Med, that'll take us to the Instagram, and I'll go over a couple of things.
All right. Can you see it there?
Yes, I see it. If you could click on, for those who are joining us for the first time, you can go follow us on at Official Club Med, and we put all of our content there. And a very common question for people, for us, is how do we get verification for these hours? So if you click on the link in the bio, if you click on Dr. Martin, if you could click on the link tree, we have this very interesting layout. We have everything that you need there. Dr. Martin, if you could click on the guidelines to putting sessions on application and resumes. So right there, it'll explain everything that you need to know to how do I list my calls and what you need to know there. That's a pretty common question that we get. So I just wanted to address that before we get started. And we can go back to our call now. Dr. Martin.
Fantastic. All right, let me get back to the PowerPoint. Then let me move this over real quick. Let me see how I maximize it. All right, there we go. Okay, guys, so let's get started. I think you guys could probably, I don't know why this is still up at the top of the screen. Let me see here. Guys, I'm not like the most tech savvy, so bear with me as I get this pulled back up. All right, here we go. All right, so I'm just going to go through a little bit of introduction again. So to begin with, Dr. Tommy Martin, I'm a MedPeds resident. So again, that's very confusing for a lot of people what MedPeds is. And so again, it is a combined residency, meaning that you do two residencies together. They just combine them and you have to do them in 4 years. So I'll be completely 100% an internal medicine doctor. And I'll be completely 100% a pediatrician. Usually internal medicine and pediatrics are 3-year residencies, whereas combined MedPeds, they combine what would have been 6 years into 4 years. So that's what I'm currently doing. And I'm in my 3rd year of that. So getting pretty close to being done. So let's just do a little bit of background. I could talk to you guys kind of about how I got to where I'm at. So I grew up in southern Missouri, a tiny, tiny little town in Thayer, Missouri, about 2,000 people. My graduating class was like the biggest class they've ever had, and it was 50 students. So, like not very large at all. I was top of my class out of the 50 students that were there. I did graduate as valedictorian. Just some more background on me is, I am a first generation doctor. Neither of my parents graduated high school. So I learned at a very young age what it means to work extremely hard. I saw my mom and dad working extremely long hours. They opened up their own business, a scrapyard. And with that, my mom would come home like black from head to toe, just working and working. So from a very young age, I learned about working hard and a good work ethic. And my parents definitely encouraged me to pursue anything in the world that I wanted to do with my life. And it just so happened that would be to become a doctor. So in high school, I played football, basketball, and baseball. My favorite was football. As you can see there, I was able to do pretty well at football, and while still staying, into my academics and graduating with a 4.0. Now, for those of you that may think, oh, he must have just been naturally smart. He must have been naturally gifted to be able to do that. That is not the case whatsoever. I can remember in first grade studying for hours for a spelling test to make sure I made 100%, and I can remember just in high school and an undergrad going to school 2 hours early to start studying before school started. And so I was never someone that was naturally smart or just naturally gifted. I had to work my butt off to get the grades that I wanted. And so I just studied and studied. It was kind of funny. I was really into football, and I got made fun of all the time because I would take my biology book or my anatomy book to my football games to be studying before the games. Now, thankfully, I was decent at football and I ended up being, I think I got defensive player of the year, and I was first team All-State. And so they couldn't give me too much crap because I still did do okay. But they would still give me a lot of crap for studying so much. But anyway, so I finished up high school and I wanted to play college football. So I went to Kansas Wesleyan University in Salina, Kansas. And there I played outside linebacker in football, and I majored in biomedical chemistry. So that was another thing, that I had to work really hard at. I wasn't naturally gifted in athletics, wasn't naturally gifted in school. So even in college, I had to work my butt off. I studied and studied and studied. And I ended up taking a lot of credits during college. I took about 22 credits a semester because I wanted to graduate in 3 years.
A lot of credits.
Yeah, those that are in undergrad right now may understand that. So like I would take 22 credits a semester, and the whole reason being is that I wanted to graduate in 3 years because I wanted to become a doctor like as fast as I could, And so I did that, and I was able to graduate with a 3.89.
That's great.
No,
How did you balance that? How did you balance the 22 credit schedule with everything that you were doing?
Yeah, and I'm going to get to that. So I will, I have a slide on that. So I will definitely, I'm going to make people keep watching until they get to the balance slide. But I will talk all about that. And also in undergrad, I was what was it called? I think it was called an ambassador of the school, where I give people tours and things like that. I was also a tutor. I worked at a youth center. I did about 20 hours a week at a youth center there, which I just loved so much. And then I worked another job and worked with children with autism. So I had about 3 jobs while playing college football and taking 22 credit hours. And so like I was always crazy, crazy busy and crazy swamped. But I was able to get it done. And I'll talk about that here in a minute. And then quickly, I just want to share about my journey, because now, like I've decided to do pre-med and I've done well in pre-med, but I wanted to tell you guys like what made me decide to become a doctor. And so I know people watching this could be of all different faiths, and that's completely 100% fine. And I respect that 1000%. We could be of different faiths and still love each other and share our stories. And so I'm going to share my story with you about how I believe that God brought me into medicine. And so what happened when I was about 13 or 14, I worked with children with autism. So I've done that since very early on. And there was this woman there who told me that she thought it was God's plans for me to become a doctor and to go to many nations and heal people. And she had me record that on my phone. Well, I thought she was crazy. Like I didn't know this lady. I was like, yeah, whatever. Like I don't even know about college yet, so I didn't think anything about it. But I recorded it on my phone. Well, then I graduated high school and I went on a mission trip. I was going to be a teacher and a coach, dead set, 100% teacher and a coach, living the life and having the summers off and just coaching football. That's what my goals were, where I went on a mission trip, and the sermon that night was about, what are you going to do with your life? Like, what is God's plans for you? And so, or what are God's plans for you? And so I went down, and the pastor there prayed over me, and he said, I truly believe that it's God's plans for you to become a doctor and to go to many nations and heal people. And I was like, whatever, like that's kind of crazy. I don't know. I'm going to be a teacher and a coach. So I went home, and when I got home, my uncle had bought me a new laptop for graduation, and I transferred everything over from my old laptop onto my new laptop. And I saw this audio file. I was like, what in the world is this? And I clicked on it, and it was that crazy lady from back when I was like 13 saying the same thing. I was like, what in the world? There's no way. So from that day forward, I decided, and not only did I decide that I was going to be a doctor, but also I saw how much it fit my passions. And like, even at a young age, I was working with children with autism and, trying to do like medical type stuff. So it really fit. So short segue, but wanted to share with you guys how I got into medicine, and I've never changed my mind since. And it's been so, so sweet. So then I got into undergrad, told you guys about that. I graduated with a 3.89, and then it was time to take the MCAT. Well, I had never really studied for board exams. I never really, I was like, I always studied extremely hard and done well. And so I was like, well, I've studied literally for the last 16 years of my life. Like, I think I'm prepared to take this exam. So I just went and took the MCAT. Well, I ended up doing terrible on the MCAT. Probably the worst score in the history of the MCAT. But I wanted to graduate early. I wanted to go to medical school early. And so that's exactly what I did. I applied to medical schools and I got into St. George's University, which is in the Caribbean. So I went to a Caribbean medical school right out of college. So kind of a long background, but kind of tells you how I got to the Caribbean. Really quickly, has there been any questions that I should answer outside of the balance question, which I am getting to here in a minute?
No, so far so good. Just people are just like commenting like not it's 22 credits. People, but other than that, we've been good. You can keep going.
Okay.
No, all right.
Great. Okay. So then I went to St. George's University. And again, I went to the Caribbean mainly because I did poor on the MCAT and I didn't want to retake that exam. And so mainly because I wanted to start early. And now I did go through a lot of prayer and make sure that that's what I thought God's plans were for me. So I went to the Caribbean. At the Caribbean, it was the hardest thing I have ever done in my entire life. My first semester, I got kicked in the teeth. I did poorly on my first exams. I was like, you've got to be kidding me. Like, I came all the way out to Grenada to get my butt kicked by these exams. Wasn't doing well at all. And I was like devastated. I didn't know what I was going to do. But then I learned how to study, started studying much more efficiently, and my grades skyrocketed, like absolutely skyrocketed. And I also met my beautiful wife, as you guys could see right here in the pink. So that's, we met during our second year of medical school. I guess it was actually during our first year-ish. So we met.
You guys started seeing each other and then got together about the second year.
Well, kind of. That's like a long story that like might take, I mean, it's not really that long. I'll give like cliff notes of it really quick. And then if people want to ask more questions, they could ask in the chat. But like the extreme shortened cliff notes version of it is I had never met her. I did not think I'd ever met her before. She says we'd met a couple times before. I didn't remember, but I went to the gym at 5 a.m. because I always go to the gym really early. And I saw this girl sitting on the bike. I was like, oh my gosh, that's the girl I'm supposed to marry. Crazy. Like absolutely crazy. I went up and talked to her. She said, I don't believe this either, but she said that I said something along the lines, hey, if you work out with me, I'll go on a run with you. I had never ran. Like I played football, right? Like we don't run for fun. Like, and so I'd never ran over a mile before. Well, after I left the gym, I prayed and I was like, God, if I'm supposed to ask this girl, like if we're supposed to go on a date, I need you to give me a sign. I got done praying, went to bed, woke up the next morning from a friend request from this girl that I didn't even remember her name. And I was like, all right, I'll ask her on a date. So I asked her on a date and we've been together since.
That's so good. I'm so happy you guys look really good in the picture. I'm happy that things are so good.
Yeah. So quick side note, on our first date, she took me on a run. And I show up in my favorite shoes, which were like crazy old with my toes like poking out the side of them, in big baggy shorts. And we ran 10 miles. I had like a stress fracture in my foot and couldn't walk for like a week. So that's kind of how that went. But anyway, so we graduated medical school together. It was such a sweet time and process, and being able to encourage one another, motivate one another, and just really succeed in medical school together. So we both graduated medical school, I think with around a 3.8 GPA, something like that. So we're very thankful for that. And then for you guys may not know how this works, but you have to, if you're married and you want to match together, you have to go through something called the couples match. And so it's pretty much where you have a big list of places that you want to interview and you try to match them up. So Phoebe and I, we went through the couples match together and we were able to match it one of our top choices. And so we ended up here in Little Rock, Arkansas together. So that was a really great time. And then if you guys can see this picture over here to the right, right after we graduated medical school, we went to Kenya and we worked in a hospital there for a month, as I was a combined MedPeds doctor and she was a pediatric doctor there for a month. So now we bring us to kind of where we're at now. I'm a third year resident and she's a third year resident. We just recently had our sweet baby boy who is currently sleeping upstairs. I have his monitor here. I'm monitoring him. And so he's 5 months old now. We had him during the end of our second year of residency, and it has just been a very, very sweet time. And we're just so thankful. So this is like right after he was born, the picture on the left. So I'm really big into fitness. And so I was training for an Ironman in this picture. I did an Ironman when he was 1 month old. And then this picture here on the right, we just did some family pictures and he's about 4.5 months old in that picture there.
He looks really cute. He's right now.
Yeah, he's like teething, he's laughing, he's playing, he's just getting so much more life to him, which has been so fun. So fun. So just a couple other things with current life. Right now, I'm not 100% sure what I want to do with my life. I love hospital medicine. I love hematology, oncology. I love sports medicine. There's so many things I love. I'm not sure what I'm going to do. My wife is going to do pediatric emergency medicine, so she's pretty pumped about that. And then other current life things. I'm really big into fitness. I love fitness. I think it's a great way to avoid burnout in medical school. And so I do a lot of marathons. I lift a lot of weights. I do a lot of Ironman, stuff like that. And I truly enjoy it.
There's a question that I see in the chat. So
Yeah.
I know that you briefly mentioned that like it was difficult for you to study like in the beginning of medical school. So the question says, what were some of the efficient ways to study in medical school, and how did you kind of like come to that? And if you could briefly describe that, and that'd be great.
Yeah, for sure. And so I know that we have like some high school students here and we have some undergrad students here. And so, every step along the journey feels the same way, but then you grow so much. And that's why it feels the same way. So like when you go from high school to college, it's going to feel like someone has a fire truck with a fire hose and they turn it on and like blast you in the face trying to tell you to drink from it. Well, then when you go to medical school from college, it feels the exact same way. And you're like, oh my gosh, I thought I had learned how to study. I thought I was doing everything right. But when I got to medical school, I realized I wasn't. And so some things that I did that truly, truly helped me, one would be active recall. And the second would be spaced repetition. And so I'll first talk about spaced repetition. And what that is that let's say that you have a lecture tomorrow and you already have your notes for it. So you pre-read your notes and that should only take about 15, maybe 20 minutes. You're just getting kind of like the gist of what's going to be covered. So you see the material once. The next day in lecture, you see that material again because you're not playing on your phone on watching my TikTok videos. You're paying attention in class. And then after class that night, you're going to go through that material again. So in 24 hours, you should see the material 3 times. So spaced repetition, right? Like a few different hours, you've seen it 3 times. Well, then within 48 hours, you should see that material again. So that's your 4th time. And then within about 96 hours, you should see that material again. And so I would keep a journal and make sure I did this with every single lecture. And this is how I memorized a vast amount of information throughout medical school. Now, the important thing about each one of those passes is that you cannot just read it, right? Like in a couple of years, my kiddo Oliver would be able to read it. That's not teaching you anything. You have to do active recall. And so what that means is with each repetition, do not turn it over and look at it until you physically cannot recall anything from your mind. And like after you sit there for about 3 to 5 minutes and you can't recall anything else, then look at your notes and see what it is you forgot about it. Now those 2 tactics made my GPA go from like almost failing out of medical school to graduating with above a 3.8. So I would highly, highly recommend those 2 tactics.
Yeah, I believe that's completely true. It's more about active learning and repetition. You're not going to learn the material one time. If you give yourself time and you do it over and over again, you're better able to learn that. I completely agree with that.
Yeah, 100%.
Okay. And another question. So Could you talk about just briefly like pros and cons of Caribbean medical school? Like I've heard that it's kind of like it's difficult to match in the residency. I mean, I think you might get that on later, but really quickly, like what are your thoughts on that? Like,
Yeah, I would love to talk about it. And this is something I get all the time, and you hear it if you go on like the forums on the internet, like they'll make you scared to death to even fill out an application to a Caribbean medical school. And so there are definitely pros and cons. Okay, so I would say we can start with some of the cons. One would be that it's extremely expensive.
right.
Okay, so like the United States schools, I think on average it's between like 190 to $250,000 of student loan debt. The Caribbean on average is about 400,000.
That's
So
over 4 years, correct?
yeah, yeah, and so that's a considerable, like that's a lot more money. Now you are going to be a doctor and should be able to pay it off, but still, that's a lot more money. The other thing would be that it is much harder to match into residency. Like that is just the truth about it. And so what that means is that you have to do better on your boards, and you probably should have more like either extracurricular or research or whatever it is that you're passionate about. You should have more of those things on your CV. And so I'll be completely honest, between my wife and I did well on my boards and had a pretty good chance at matching to a lot of specialties that I would want just because of my board scores. But I'm telling you the next part, because I want you guys to know that board scores are not everything. Okay. And so my wife, she's extremely brilliant, much more clinically intelligent than I could ever be. But she didn't do quite as well on her boards for whatever reason. And she ended up with more interviews than I did you know and so she got below average for what you should from a Caribbean medical school, and she still got more interviews than I did and more interviews than some of her state school colleagues
Right.
that she was friends with. And so I tell you that to let you know that yes, going to Caribbean medical school makes it harder. Yes, you probably should have higher scores on your boards than the US counterparts, but it is not an end all be all, and you could still become an amazing physician by going to a Caribbean medical school, even if you don't make the greatest board scores in the world. Okay. Um, Another con would be that you're away from your friends and family. You move to a third world country and you're there and you make it or you don't. Okay. And so another thing that you'll hear a lot of the time is that it's sink or swim, that there's so many students that there's no way you'd ever get help. I believe that's true for some, not for all. And I'll explain why in a second. So now I'm going to get to some of the pros. One is it's extremely hard, like extremely hard. It made me study so hard and learn how to study so efficiently that I did very well on my boards. And I believe it's solely because of the education I received at St. George's. It was an incredible education, and I had to work extremely hard. And I'm so thankful for that. Two would be the support system. Now, a lot of people say that it's sink or swim if you go there because they have like 2,000 students each class. Well, that is true if you don't reach out for help. I knew every single professor by name. I bet I had 75% of the professor's cell phone numbers, and so I was really plugged in. And the reason being is day one of medical school, I went and introduced myself to every single faculty on campus. I didn't care if it was a janitor. I didn't care if it was someone that owned a restaurant there. I didn't care who it was. I introduced myself to every single person.
You can get to know so you can get to know as much as people as possible, which is a good thing. Yeah.
Yeah, 100%. And that's something not even just in medical school, but in life in general. A rule that I live by is if there's someone within an arm reach of you, you need to introduce yourself to them and show them love and let them know that you care about them. So like you can meet people all over the world, and you never know when those encounters are going to make a difference.
Correct. That's
Um,
right.
a couple other pros really quick is that living in Grenada, that's where St. George's is, there were so many opportunities for community service that we got to do so much. Like we got to help out so many children, so many different like schools there, and it was just great. So in short, those are some of the pros and cons, but I loved it. I would do it 10 times over again, which I'm biased. I met my wife there, so like of course we're gonna love it so much. But I think even if I wouldn't have met her there, I still would have loved it.
That's great. It's more than just what you find on the internet. It's how you put yourself together and the kind of things that you get yourself involved in. Doesn't matter where you go to medical school. That's the key is how you, wherever you are, how you get yourself involved in those things, and that's going to be more important, like you said, than board exams. Even though
Oh,
those are important, but other things are also important, such as extracurricular activities.
Yeah, 1000%. Like it is up to you to make what you want out of any and every situation.
And this isn't
So
in medical school. This is even in undergrad. I mean, it follows the same story.
right. Yeah, 1000%. Like if you are right now finding yourself hating undergrad, what I would personally do is do a deep self-evaluation and see why. Like what is going on that's causing you to hate it so much? And then tomorrow, wake up and change it. Wake up and go love on as many people as you can, help as many people as you can, meet as many people as you can, and just quit focusing about how much suffering you're going through and start focusing on about how much love and positivity you could be pouring out to the people around you, and watch how big of a difference that'll make. Just your attitude in general about whatever it is you're going through. And that's not just about school. That's with everything.
Correct. That's important. Okay.
Okay.
Um, we'll continue with the presentation. Yeah.
Okay, awesome. So I'm going to get to my typical day, and then I think the next slide is about balance. So finally, we're getting to it. So I'm going to share with you guys something that I call like my unshakable or my unbreakable schedule that I've done literally since almost high school. Okay. And why is because I knew if I wanted to be successful, this is what I had to do. I wasn't naturally smart. I wasn't naturally athletic, but I had goals that I wanted to achieve. And so if I wanted to achieve them, I knew I had to work. And so this is how it starts off. And this is still what I do today, except for you guys might keep me up past my bedtime tonight. But so like my typical day is I wake up at 4 a.m. every single day, no matter what, waking up 4 a.m. And then when I wake up, I do some Bible studying, I do some journaling, and I drink some coffee. And that usually is from 4 to 4:30 ish. 4:30 to 6, I work out, depending on what my goals are at the current time. 6:30 to 8, I make breakfast, which I misspelled here. Forgive me. But this is if I'm in the clinic. So in residency, you go through different rotations. One would be clinic life, one would be ward life, and one would be in the ICU. Pretty much clinic life, you're working 40 to 50 hours a week. Ward life, you're working 60 to 80. ICU, you're working like 80 to 90-ish hours. Okay. So back to the schedule. Make breakfast for myself, Oliver, and well, Phoebe makes all of her breakfast since she breastfeeds, but I make her breakfast, which supports his breastfeeding. And then I go to clinic from like 8:30 to 12. We have noon lecture, 12 to 1, and then I have clinic 1 to 5 afterwards. And then I work out again, 5 to 6:30. 6:30 to 7:30, we do Oliver's bedtime routine. Hence, he's currently sleeping. And then 7:30 to 9, I have time with Phoebe. So this is my unshakable schedule that I use for every single rotation, no matter what. So the only differences here between clinic life, which is 40 hours a week, ward life, which is like 60 hours a week, and ICU life, which is like 80 hours a week, is that my workouts are cut down and my like breakfast and time in the morning is cut down a little bit. But if you still hold this schedule, you can accomplish so much. And why is because the rest of the world is sleeping from 4 a.m. to 8 or 4 a.m. to 7. So that's like either 3 hours or 4 hours where you get to put in work to whatever your goals are. This could be, go ahead. Sorry.
Yeah, that's where I'm. This is very amazing what you're doing. So like you'll be able to get ahead rather than when people are sleeping. So motivate yourself into doing things so you can get started ahead of day. Yeah.
Yeah, 1000%. You know, like in like those 4 hours in the morning, I think instead of actually being 4 hours, they're actually about 8 hours. And why is because there's no distractions. No one's up messaging you. No one's up emailing you. No one's taking away from your time to get stuff done. Whereas if you reverse that and make it from like where you're doing this from 4 p.m. to 9 p.m., you have like every distraction known to man, right? And you're not going to get anything done. So waking up early and getting to bed by 9 o'clock, I think is so essential. And then this 9 o'clock bedtime, it has to be 9 o'clock because if you're going to wake up at 4, you need 7 hours of sleep every single night for you to make good grades, for you to feel good, for you to have energy to exercise and to work out and to recover. 7 hours of sleep, I would say, is the bare minimum everyone needs. Okay. And then I'm going to play a quick video just to demonstrate to you like what my life is truly like. So we can pull it up here real quick. All right. I don't know if I can maximize this, but hopefully you guys can see the screen.
That should be good if you want to play.
All right. run yesterday. After that, I take a protein shake with some flaxseed, chia seed, and cocoa and peach bit. Then get to the hospital around 5:45 and log into Coursera. Do all my pre-rounding on my patients, checking all their labs, seeing how the night went, doing some notes. Then the best part of your day being to go see all of your wonderful patients and their parents and time with them. Hopefully rounds will normally get done between 12 and 2. Today was on the later side of things. It was around 2 p.m. when we got to get some lunch, and I had some chicken with some veggies. After lunch, you finish up your notes, do any procedures you have, and then go tuck in and say goodnight to all of your wonderful patients and their parents. And then usually tonight I'm supposed to have a swim, but I'm going to skip that, and I'm going to go spend time with my wonderful day in the neonatal ICU. Wake up at 3:45.
Man,
So yeah, that's a lot. And it definitely is a full day, but it is it's so great. It's so sweet. And in residency, you don't have too many ICU months where you have to live a life that is that packed. But when you have a schedule like the one that I have here, it still makes it possible and makes it able for you to do other things. And another really great thing is you get one day off a week during residency. And so I usually utilize that week to do my meal prep, to do my long workouts, to spend time with my wife and do things like that. And so having a schedule like this, I think, is beneficial no matter where you're at in your training.
that's great.
All right. So how do I balance it all? I kind of showed you guys there. The number one thing is getting enough sleep. So sleep is going to help you balance all your hormones throughout your body. Also, it's going to help you have energy to work out throughout the day. That exercise during the day is going to fuel your brain and give you more energy just to be filled with life, to perform and to do well throughout your schooling. Like there's countless studies that show how beneficial exercise is to academic performance and for even alleviating depression. And so exercise is just so important, even if you just get a little bit each and every day. And so I think if you guys have a screenshot, or you guys can have these slides, use that schedule and see if you could implement it. Now, again, it starts with 7 hours of sleep at least every single night. And then something that I want to talk about here and why is because there's a lot going on in that schedule, and there's a lot of things that I'm doing. There's medical school, there's time with my family, and there's exercise. And so a lot of people say, well, Tommy, like, how do you find the motivation to do these things? Like, how do you get the energy to want to do them? And there's a couple things that I want to share with you guys before we get to this case presentation. So one would be, I really think that we have to stop asking, like, how do we get the motivation to do these things? Because motivation is a feeling and will always be waxing and waning. So if we always rely on motivation, if we went a night without enough sleep, or maybe we didn't eat enough, or maybe we ate bad food, our motivation can wax and wane, and we'll skip out on a lot of things that we don't want to do. So I think the more important thing is, how do I remain dedicated to the goals that I've set? So for you guys, maybe pre-med, how do I stay dedicated to this goal of becoming a doctor? And there's a couple verses in scripture that I live out every day that I think helps me more than anything. So one would be Romans 8:18, and it says that our current sufferings will never be compared with the glory revealed within us. Now, I'm taking it out of scripture and using it to apply to your work in school and in life and in general, but I think it directly correlates. And so what that means is that your current sufferings of skipping events with friends, skipping going out to party if you do that in college, skipping staying up late at night so you make sure you get up early, skipping family events because you're in medical school, the countless hours of studying and the headaches that you're going to have to go through, all of that suffering will never be compared with the glory you feel and you experience when you're holding the hand of a patient at bedside and they tell you that you made a difference in their life, or you're able to tell them that you healed them of their cancer, or you're able to hug the neck of one of their loved ones after, your patient passes away, and you're able to comfort them and embrace them and share with them, that the most important moment in their life, and you're able to make them feel better. Like, all that suffering that you experience will immediately vanish in that moment because of how fulfilling that moment at bedside is. Like, I truly believe the magic moments at bedside is where burnout burns out completely. And I just hope you guys remember that forever and you never sacrifice those moments. Okay. And then Another verse that goes with these things, right along these lines, is that in these sufferings, what is your attitude in these sufferings? And if we look at Romans 5, it says, we will rejoice in sufferings of all kinds, because we know that these sufferings are going to produce in us endurance, perseverance, character, and hope. And so as you guys go through this journey and as you experience all these sufferings of who knows what types of sufferings you're going to experience, just know that they're going to be used for incredible things for this journey to help you succeed. And so I don't mind to share with you guys some sufferings that I experienced on my journey. But when I was in medical school and I told you that I wasn't doing very well, I was also going through a very hard personal time. Uh, my father had relapsed and was got addicted to drugs again and had an affair on my mom, and my family split up. Within 3 months, my grandmother passed away, my uncle committed suicide, and I had two other family members who died. All of that within 3 months. And I was broken and I was shattered and I was failing medical school and I just wanted to give up. But in that moment, I found these scriptures and I knew that all of these sufferings God was going to use for my future glory and to build in me endurance, perseverance, character, and hope. So in my suffering, I was able to rejoice knowing that God had much bigger plans on the other side of these sufferings. And so whatever you guys are going through, whatever sufferings you are going through, rejoice in them and think of the mindset of like, these are going to help me for my future goals. These are going to help me when I'm at the bedside with a patient that maybe went through a similar thing. So I hope you guys could think about that in the midst of your suffering and turn the suffering around to be a very glorious thing. And I truly believe that it is in our darkest moments where we find and foster our greatest potential, and where those moments are where you're going to be able to get the characteristics that are going to help you achieve more than you could ever imagine. So I hope you guys hold on to that. And then the last thing that keeps me motivated, or not motivated, dedicated, is that in scripture, it says that our life is a vapor in the wind, that it's a mist in the wind, that it's here for a second and then vanishes. So that tells me that I don't know if this live YouTube session is going to be my last opportunity to talk to someone. I don't know if tomorrow will be my last day. I don't know if this next week will be my last week, the next month will be my last month, or if this will be my last year. So knowing that my time on this earth is contracted, knowing that I could vanish in an instant, that means every single second I need to live with everything that I have, that I need to live with so much heart, so much passion, so much dedication, and not only for my own personal goals, but for everyone around me. Your every encounter with every single person could be your last. The way you treat the cashier at Walmart, the way you treat the homeless man at the stoplight, like that could be your last interaction. And how do you want that to be remembered? So whether it be medical school, in your personal life, in your fitness life, whatever it is, every second is infinitely and eternally valuable. And I think that we have to live every single one of those seconds like that. So that's how I stay dedicated. That's how I balance my time. And I hope that blesses or helps someone along this journey.
It definitely, that was really inspiring for me. And I'm seeing a lot of comments and people are very inspired by what you just shared. And I completely agree on what you said about everything. I mean, sometimes all of us kind of like put ourselves in like the end goal, and sometimes the pain, we feel like it's not worth it for us to go through it. But we got to remember ourselves that like we got to push through it, and the end goal is there for us to be able to get to, but we got to work through it. And you can't earn success without hard work. I completely agree with that. Yeah.
And I don't mind to share encounters that just kind of proves the point that it's worth it. I'll share one. I'm not going to use any patient identifiers or anything, but I had this encounter with this one patient. It was during my surgery rotation, and this is actually how I decided to do MedPeds. But it was during my surgery rotation. It was crazy early in the morning, and we had to go tell this patient that we're going to have to do a biopsy because they probably had cancer. So the chief resident walked in and said just that. So we have to do a biopsy. You have this big mass and you probably have cancer. So we need a biopsy and find out. Well, I could tell that this patient was distraught, like absolutely destroyed, and didn't know what to think. Well, the chief resident and the rest of the surgeons was like, okay, well, we'll be back, this afternoon after our surgeries. We have to get in the OR. Well, I saw this patient had a cross necklace. And so I stopped and I said, hey, is it okay if I stay behind and pray with the patient? And the chief resident said, yeah, do what you need. That's fine. Whatever. Go ahead. And so I did. I stuck around and I prayed with the patient. Well, time went by, about 3 months went by, and then I get a call from an oncologist that tells me to go to their office. I was like, okay, whatever. Go to the office and never met this oncologist. And they said, I want you to go see the patient in that room. I said, okay, this is really weird. I walk in the room and it's that patient and they start sobbing and they say, it's you, the angel that God had sent me. And they were there getting therapy and was about to be cured of their cancer. And I had never thought anything else of it. But that one moment made every single second of studying worth it. That made every single sacrifice I've ever done in medical school worth it. So those sufferings never even came close to comparing with that one moment. And you'll have a lot of those moments. And so just, you're so early on in your journey as a medical student or a pre-med student or a high school student, but just keep a book of magic moments. And it doesn't even have to be about medicine, just like magic encounters that you've had that'll keep you going in your dark moments. And when you experience those dark moments, go back and read your magic moments book and it'll help you. It'll set your heart back on fire and you'll just be going full steam ahead again.
That was a lot. And that was, yeah, I'm reflecting as you're saying on things on my personal life, and and I'm looking at the chats too. Everybody's very inspired and with everything that you were saying. But we'll continue.
Very good. Were there any questions that we had or need to answer before we get going?
No, we're okay. We're looking good on questions, and we'll go into the case study.
All right, guys. Well, so we're going to get to a case presentation here. So I hope, I'm going to try to keep it as simple as possible. You guys are brilliant. I know you are, and very intelligent, but you guys haven't had a lot of medicine yet. Okay. And so I understand that. And so we're not going to dive deep into medical terminology or things like that. We'll keep it pretty simple. So what I want to present to you guys is a case of abdominal pain. And I'm sure that all of you at some point have had abdominal pain. So something you guys could relate to. And so I want you guys to be thinking what caused your abdominal pain while we go through this case presentation. So this patient came into the emergency department, and a lot of the stuff is made up just to protect patient privacy. Okay. So a lot of it is made up, but it is a true scenario. And so with this, patient comes into the ED and they say, I have abdominal pain. So we have a 7-year-old with severe abdominal pain. As I said, I'm MedPeds. So I see adults, I see children, I see people all over the spectrum. So this one happens to be a 7-year-old with severe abdominal pain. And so anytime in medicine, when you get a chief complaint, that's what we'd call this, is a chief complaint, like alarm bells start going off in your head and you're immediately thinking of a differential diagnosis. Okay. So like when you have a 7-year-old with severe abdominal pain, that is like so much different than when I have an 80-year-old with severe abdominal pain. Okay. So just automatically we start thinking of differential diagnoses, and then we start asking a lot of questions, some to the kiddo, some to the parent, about what is going on with this abdominal pain. So when you get into medical school, you'll need some sort of mnemonic that might help you ask like the history of presenting illness and like how to go about it in a systematic way. And so this is one that a lot of people use. It's called old carts. You guys can write it down and use it in the future if you want. You don't have to. But so this is just like, how do you characterize their chief complaint? How do you characterize what they're coming in with? And so this is like the onset. So how long has this abdominal pain been going on? So for this kiddo, it's about 3 days or so. Okay. Where is this located at? Their pain's located in their left or right upper quadrant, upper or lower quadrants. And then you want to ask, does it move anywhere? Because if it moves places, that could lead us in one direction or another. The duration, once it starts, how long does it last for? And then the character, what does it feel like? Is it sharp? Is it nagging? Is it cramping? Like, I think everyone's been constipated, right? So like you have cramping abdominal pain. That doesn't mean it's something serious. And then aggravating factors, like what makes this pain worse? What makes it better? And then timing and severity. So when does it happen? Does it happen after you eat food? Does it happen when you're playing around at recess? And then how severe on a scale from 0 to 10? In kids, we usually use like smiley faces and sad faces. So like a 0 would be like a crying face. And then 10 would be like, or a 0 pain, sorry, would be an extremely happy face, whereas a 10 out of 10 pain would be like a really sad face. So these are just questions to ask about the abdominal pain, or about any presenting illness that they have. Okay. So for this patient, they had abdominal pain. It was really kind of diffuse abdominal pain located all around the stomach. It was more prominent in one of the quadrants, the right upper quadrant and the lower quadrant. It did not move anywhere. The duration of it started 3 days ago, and it's just worsened throughout this time. The kid said it felt like a knife in her stomach is what she had said, about a knife in her stomach. And so it was severe to her. Mom said that she also said that it was like a stabbing pain. She really at this point didn't say anything made it worse or anything made it better. She did say like spontaneously here and there, it might get better or not get better. And then the timing of it was, off and on. And then at times it was 9 out of 10. Other times it was like 4 out of 10. So that's kind of where we're at right now. And throughout this presentation, I may say he, I may say she. Sex doesn't matter. I'm going to say he or she. So just bear with me. So after you get like everything you can out of abdominal pain, then you go on to some other stuff. There is one other thing when you're taking a history that is important to ask is like, was it associated with anything? And that's kind of like aggravating or alleviating factors. But like, again, associated with eating, associated with movement, associated with bowel movements, especially like as people get older, there's different things that can go into that. So then we get into the past medical history. The one amazing thing about pediatric medicine, for most pediatric medicine, there usually isn't too much past medical history. Now, sometimes there definitely is. You have kids that deal with a lot of medical issues, but compared to my adult counterparts, their past medical history usually isn't too much. So this patient didn't have much, never had any surgeries or anything. Family history, mom had Crohn's disease, grandmother has irritable bowel syndrome. So Crohn's disease is an irritable bowel disease, whereas IBS is different. It's a different syndrome. We don't have to go into all the details of that. Social history, lives with mom and dad, doing well in school, no pets, recent travel, smoke exposure, or no lizards or turtles. So when you have a kid with abdominal pain, the social history is very, very important. And the reason being is these weird things that I asked over here. Okay. So like, does this kid play with a lot of turtles and lizards? Does this kid have recent travel to some country? And why is because some of these causes of abdominal pain can be related to either parasites or bacteria from these different areas. So when a doctor asks you, have you traveled outside of the country? Do you have a pet turtle? Do you have a pet lizard? Like these aren't just random things that they're just trying to ask you. Like it's because these are related to pathologies or bacteria, parasites, things like that, that can cause different things. So especially diarrhea in kids can be related to all kinds of crazy stuff. So definitely you might get asked a lot of weird things at a doctor, but it is important. Immunizations up to date. That's definitely something always to make sure of. Diet, nothing big. Abdominal pain, this is definitely something you want to ask just because of diarrhea, constipation, things like that can cause changes. And then there's rare things like celiac disease that could be causing some abdominal pain as well. Allergies, didn't have any, no medications. And that was kind of like the rest of the medical history. So after you do those things, especially as a physician, you should have, like once you get done with this, you should go on to like review of systems. And I don't have it here, but review of systems is where I do start from the head to toe and just kind of go through everything to make sure I hit on everything and there's nothing added. So you'd ask about hair falling out or hair growth or sore throat, swollen lymph nodes, and you just go head to toe and see if there is anything. Other things that you could ask about or like what you want to be thinking about is by this point, you should have a pretty good differential about what's going on with this kid. And then you start asking like targeted questions. So like I mentioned celiac disease earlier. So with that, you'd start asking directed questions like, does this change when you eat this type of food? Does this change when you eat this type of food? Or we know that this patient might have a family history of some stuff. So then you could ask questions regarding that. And so you just start asking more direct questions to help you get down to a diagnosis that you think that they have. Okay. So then after you do that, you do a physical exam. So this physical exam, we're going to show the temperature. So 38.2, we do use Celsius a lot, but that's like above 100.4. So a true fever is above 100.4. So if we look at these vital signs in a kiddo that's 7 years old, the temperature would be elevated, the heart rate would be elevated, respiratory rate would be elevated, blood pressure is not bad, and then with saturations would be fine. So what this tells you is the kid is sick, the kid probably has an infection of some sort, and they might need a little bit of fluids. And then you just look at the child before even doing anything else. And really, the general part of the exam happens all throughout the time you're chatting with this kiddo. You know, like a lot of kids are like super pumped about just seeing someone, you know, and if they're not, if they're like, and like appear ill, there's probably something going on. So this kid looked good, looked like he'd been eating fine, well developed, but was in pain, embracing their stomach. The HEENT exam. So this is just like everything up in here. Just a little congestion. Had a little bit of spots on the back of their throat. Nothing crazy. The neck, nothing significant. What we really look for, especially in kids. So strep throat is a very, very common cause of abdominal pain in kids. I know, crazy, but strep throat's very common. So you look for like swollen lymph nodes in their throat, like right around here, and see if they have any swollen lymph nodes. Their chest exam, so really like the respiratory exam, nothing alarming. Heart exam, nothing alarming. In both of those, you're looking for wheezing or things we call crackles, different things like that. If any of you have asthma, you know what wheezing is. Heart, you just look for murmurs. Some of you probably have heart murmurs because a lot of kids have normal heart murmurs. And then the abdominal exam, which is like their chief complaint. So this patient on exam had tenderness everywhere. Okay. But most prominent in the left upper and left lower quadrants. I think I said right earlier, but on exam, it was left upper and left lower. Whoops. And then the rest of the exam was normal. So by this point, we should have a very broad differential. And as all of you guys are here listening to me talk, I just want you guys to think about your stomach and try to think about everything that is from like right below your chest line or your nipple line, right above your belt line. So like, what are all those things in that area? And all of those can cause abdominal pain. Okay. And so I'm just going to go to my next slide that kind of shows this in a little schematic. Okay. And so if we think about everything that you could have, and this is from Online MedEd, a resource that I use that helps me study a lot. So in medicine, a lot of the films are read like opposite. So on the left side, this would actually be their right side. And on our right side, this would actually be the left side. Okay. So when we think about everything that could cause stomach pain, there is a ton. Okay. A ton. So you have your liver on your right side, you have your gallbladder, you have duodenum, but for you guys, like that's just intestines. So you have intestines all throughout your belly. So that would be something, you know, that you'd have to think about. Appendix, especially in kiddos, you have to think about appendicitis if they're having abdominal pain, especially right lower quadrant abdominal pain. For boys and girls, so you could have ovarian torsion, testicular torsion, things like that can cause abdominal pain. You have the ureters, which is like your pee pipe, I guess you could think of it as, and your kidneys. So you can get kidney stones. In kids, it'd be a little more rare, but definitely still happens. This here is like some rare stuff that we don't necessarily need to talk about. On the left side, again, you're always going to have your lungs, your diaphragm, and your spleen. And then your colon, that would be like your bigger intestine. So you have big intestines and small intestines. Both can cause pain. Both can cause problems. Okay. So this is just like a way to think about literally everything within your stomach that might cause pain. Other things, pancreas, your heart, your aorta, trachea, esophagus, and your stomach. So all things there. And then with that, we already know all of those things. Then you could also characterize the pain, and that could kind of lead you down a diagnosis. Now, we don't have to go into all of the different types of pain because this might be a little bit, too technical, but just know for different things have a different type of pain. Okay. And so that helps us as doctors kind of characterize it and say, oh, well, if they're saying that it's colicky or that it comes and goes, then usually that means that there's an obstruction. So if you have a pipe and then you have something that's obstructed, but then at times it's not as obstructed, then it could be like a colicky type of pain. But then if it's constant and happening all the time, that leads us down more of the thought that could be like inflammation, or it could be a perforation, which would mean a hole in the intestines. So that just leads us down a differential diagnosis. So at this point, when we saw a kiddo very similarly, we also got some imaging. Let me get to the imaging. Oh, labs and imaging. So we got some labs. So in labs, the white blood cell count. So this is like sticks to medicine. I think I need to do a TikTok video on this because I think it'd be helpful. But this is like how we keep track of all the labs. Okay. So we write this out on every single patient every single day. So this little schematic here, I just draw across. But this is for your white blood cells, your hemoglobin, and then your platelets. So just different type of cells. So white blood cells, anything above 12 would be like, oh, they probably have an infection of some sort. Okay, so above 12 would be what we call leukocytosis, leuko being white and cytosis being a lot of cells. So increased white blood cells. And then these other things aren't too worried about, and you don't need to worry about this. And then this panel here, which is just a bunch of numbers to you guys, these are all electrolytes. So this would be sodium, potassium, chloride, CO2, BUN, creatinine. Again, stuff that you guys probably don't care too much about, but this looks fine. Okay. So the main thing for you guys here is we checked this white blood cell count. It shows that there's probably some sort of infection going on. And then we ordered some routine labs. Like I told you that strep throat could be a common cause of abdominal pain. So we did a rapid strep, which was negative. We did influenza, which was negative. Every kid pretty much that goes into this would be another very common cause of abdominal pain, would be a urinary tract infection. So we checked a urine analysis, which just helps us evaluate the urine. It was also negative. And then we did some inflammatory markers in ESR and CRP. Okay. And then amylase and lipase, those are mainly to look and see if we're concerned for like pancreatitis in a little kiddo. Okay. And then the liver function tests were normal. So these were just like initial labs that we got to kind of see if anything stuck out that was like, yes, this is for sure the diagnosis. This is for sure what it is. Didn't exactly give us that so far. Okay. Then we go on to some imaging. So these imaging are from Radiopedia and ARA Radiology, just some images I had here. So this is a chest x-ray. So the reason to get a chest x-ray on abdominal pain is because remember that your abdominal pain can be characterized by anything, even along this border here, like your diaphragm and your lower lungs. So when we looked at the chest x-ray, everyone needs a systematic way to go through it. Now, for you guys, you may not look at many chest x-rays now, but once you are able to go in shadow in person as a medical student or as a pre-med student, just something super easy that you could remember, and the doctor would be like, oh, wow, you know that? But would be just an easy way to quickly look at a chest x-ray, okay? So the only thing I want you guys to remember is A, B, C, D, E, F, okay? So just the alphabet, super easy. EF. Okay. So A is airway. And so when you're looking at this doctor who's going to think you're like the smartest high school or undergraduate student, the airway, you're just looking here at the trachea, finding the bifurcation of the trachea and then following it and making sure there's no big obstructions or lesions there. Okay. So A, like your ABCs, A is airway. Bones, that's easy. B for bones. Just quickly look at the bones, make sure there's no fractures. C for cardiac, look at the heart, and you want to make sure that the heart is not enlarged. Okay. So if you just look at it here, if it takes up more than 2/3 of this whole area, then it's probably enlarged. This one doesn't look like it at all. Okay. And then the diaphragm, that would be this white structure here. So you just make sure that it's there and not missing. And then also you want to make sure that these angles, that there's an angle here. That's all I'm going to tell you. If you even tell anyone this much, they're going to think you're the smartest high school student ever. And then everything else is just like looking at the picture as a whole and making sure that there's nothing drastic. And then any foreign bodies. So did this kid swallow a coin and there's a coin stuck here, or did this kid swallow, I don't know, a truck or a small little toy and it's stuck somewhere. So just look for foreign bodies. Again, super easy, A, B, C, D, E, F. You guys should be able to remember that. And again, no one would expect you guys to know much about that. So if you knew that, it'd be great. So the chest x-ray, we didn't see anything. And then on we did an ultrasound of the appendix and the appendix looked completely normal as well. Okay. So from here, the patient was admitted to the hospital. Oh, sorry. Abdominal series. So an abdominal series also shows more of the stomach, which I didn't put on here, but just showed that the kid had a lot of stool, like a lot of constipation, like just filled full of poop, which happens a ton. Okay. So far, this 7-year-old, I'll just give a quick recap. So far, the 7-year-old with abdominal pain and fever, the labs were significant for increased WBCs, white blood cells, leukocytosis, like I told you, and then these inflammatory things. Does not have strep throat, did not have influenza, did not have had a clean urine analysis. So we got blood cultures and urine cultures, and they went into the hospital to get IV fluids and to hopefully have a bowel movement and to get better with that and for further workup. Okay. So the next day, the patient had worse abdominal pain, and this time was like literally writhing all over the bed in pain. Okay. And the also had a fever and developed a cough. So at that point, a CT scan was done. This scan is from ResearchGate. And so sometimes when a chest x-ray doesn't show you much, it's either that nothing was there or the patient was dehydrated, or it could be that the whatever it was developing. So if you look here, these lung fields should not look like this. There should not be big like big pockets here of pneumonia. And so this would be like a multifocal pneumonia in this CT scan. So with this, the CT scan was done, and it just showed that the patient definitely had a multifocal pneumonia causing the abdominal pain. Okay, so the kid ended up getting IV antibiotics for a couple days until they got better. And here is further imaging. You can see it here again. Ended up getting IV antibiotics until they got better, and then was sent home on oral antibiotics after that and did completely fine. So the CT again showed left and right consolidations consistent with multifocal pneumonia. And so the whole reason I bring up this case is because a lot of the time in kiddos, we think that abdominal pain automatically means that they just have constipation. And we forget about a lot of other things. And a lot of you probably deal with constipation and have constipation and end up getting abdominal pain. But a rare cause of abdominal pain in children, which would be pretty, or is a little more uncommon, is pneumonia causing abdominal pain. Okay. And so pneumonia, remember that when we look at the abdomen, the lungs go down right against the diaphragm, right? And so that area is actually innervated by the same nerves, T9, in your abdomen. So you can get referred pain to your belly from having a pneumonia. So whenever you think of abdominal pain in a kid or just abdominal pain in anyone really, people should not rule out pneumonia immediately, and should be something that should be on the differential diagnosis. And so not all abdominal pain is constipation. And then I'm not going to go through all of this. This is just a slide that you guys could look through later if you guys get the slide notes. But pretty much this is just differential diagnoses based off of age of patients. So from birth to 1 year, 2 to 5 years, all the way up to 18 years old. Like this kid, was like in this age group. And if you look in this differential diagnosis, I'm sorry, they did put pneumonia. So pneumonia was on that list as well. So this, we don't have to talk too much about this. This is just talking about different types of pain, how there's visceral pain. You could think of visceral pain as like a gnawing pain. Like constipation could cause that when your intestines are being stretched and causing pain. You could think of parietal pain. This would be like appendicitis, where like when you move, the inflammation there is causing pain in the peritoneum. And then referred pain like pneumonia can cause. You guys have probably seen it or experienced it eating ice cream way too fast, where your palate gets really cold and it causes you to have a headache. So that's a type of referred pain. So something you guys could probably relate to, and that would be very similar to this pneumonia pain. And then we're not going to go through these. These are just some slides of evaluation of acute abdominal pain in children. So were there any questions about the case at all?
Looks like regarding the case study in itself, I didn't see two particular questions, but it was still amazing for you to, I think you were doing a pretty good job in explaining, so made sense to everybody. So that was good.
Okay, very good. I hope I didn't use too much medical jargon that was hard to understand. I wanted to try to make it as simple as possible for you guys. A very common thing we see, pneumonia, but with a more uncommon presentation.
Okay. Could you go on to the next slide, Dr. Martin?
Yeah.
Questions?
Yeah, and so lastly, I think we've been on here just about an hour or so, but I am open to answer any questions that anyone has whatsoever. So I'm an open book and would love to answer your guys' questions.
And a question that I saw in general, it wasn't related to the case study, but you know, since you're a pediatrician, how, and and you're dealing with kids, and certain kids might not be able to, describe their symptoms to the best of their ability because they're children. So how do you kind of like go with that? Briefly, if you could describe that, if somebody was not really good at describing their symptom, you know what I mean?
Yeah, so a lot of it depends on the age of the kiddo. Like once they get like 4 and above, they get a little better at it. Now, of course, they're not going to tell you like an adult, yeah, it's like in my right upper stomach and it moves down to my right leg and it's caused by this and caused by this. But they can tell you quite a bit actually. And so some things that I like to do is ask them to relate it to something else. Like, have you ever felt like this before? Or if you could describe another time that you've felt like this, tell me that. And it kind of helps you relate to what it is. But I think the most valuable thing is watching the kid throughout the whole interview, because like kids that aren't in that bad of pain, they're going to be playing, they're going to be running around, they're going to be doing all kinds of stuff in the room. But if they're not doing those things and you could kind of see where they're like, maybe they're not walking with their right leg as well, or maybe they're playing, but they won't use their right hand, or, just different things throughout your interviewing of the mom or the dad, then you'd be able to then maybe see, more about the pain or more about the symptoms. But kids, you'd be surprised how intelligent they are. And once they get that vocabulary, man, they will give you crazy descriptive ways about characterizing what they're going through.
Good. That's good. Looks like we're about time. So if you could go on to the next slide, we'll wrap things up. I want to thank you, Dr. Martin, for not only was the case study amazing, but all of the things that we talked about regarding motivation through undergrad and med school and trying to get focus and, get through the hard stuff. So there's a bigger reward at the end. That is all completely true. And, in order to be successful in life, you got to work hard. I completely agree with that. I had an amazing time hosting with you. And I believe everybody in the chats are saying the same thing. They found your story inspiration, and it was lovely hosting you. So if you want to follow, for everybody, if you guys want to follow Dr. Martin, go on to his Insta. It's at Dr. Dar. Could you say that? Could you put that?
Yeah, I should have put it here in the slide. Sorry, guys. It's at Dr. Martin. Super easy to find. That's what it is on Instagram. That's what it is on TikTok. And, I am always available to help in any way possible. If you guys need someone to talk to, if you need encouragement, if you're feeling down, depressed, whatever it may be, I would always be more than happy to chat with you. It may take a little bit before I could get to you, but I would definitely respond to any messages. And I just want you guys to know that you guys can do this. If I could do it, you could do it. And I would love to help you make it there.
Great. And also with that being said, so make sure if you have any questions, hit Dr. Martin up and ask him, and he'll be more than happy to answer your questions. And one last thing before I say goodbye is we run this program free for everybody to access. And we just started our new volunteering program too. So you can check out those details on our Instagram at Official Club Med. And with that being said, we want to support everybody and we want to make the program free. And these calls are free for everybody to attend. But with that being said, we still have costs associated with this program, such as paying for Zoom, sending out emails. We have a server that we have to pay. So all those costs add up, and we're college students. So if there's anything that you guys could do help, please donate. Our Venmo and Cash App is presented right there at Club Med CHU. And we just started a GoFundMe. I will put the link for the GoFundMe in the bio, in the chat. And you can also find it under our Instagram bio if you want to donate that way. But all donations are appreciated. And I want to thank everybody who took the time out of their schedule to come here and join the call. And I had a lovely time hosting with Dr. Martin, and we'll see you next week with another call. Thank you, Dr. Martin.
Yeah, of course. See you guys.